I'm Nima Rajan, and this is Forum Daily Week in Review. A 6-month Canada-wide shortage of children's painkillers has parents reaching out to pharmacists about alternate forms of treatment. Meanwhile, some are crowding hospital rooms to get access to the scarce medication. Health Canada issued an advisory earlier last month warning that children's ibuprofen and acetaminophen were in short supply due to unprecedented demand. Now, today, Health Canada said a foreign supply of children's acetaminophen will be available in pharmacies in the coming weeks. This while ibuprofen shipments have already arrived and are being distributed to hospitals. Meanwhile, cold and flu season this year comes with the added risk of COVID-19 variants and an uptick in respiratory syncytial virus among children. Well, joining us now to give us the latest on the situation and her advice for parents is Dr. Anna Banerjee, a pediatrics expert and associate public health and pediatrics professor at the University of Toronto. Dr. Banerjee, welcome to Forum Daily.
Thank you for inviting me.
So we mentioned Health Canada is securing foreign supplies of acetaminophen, and ibuprofen shipments have already arrived in Canada. So considering these efforts, what is the current state of this national shortage?
Well, from what I see and what I hear, there's still it's very difficult to get ibuprofen and acetaminophen from over the counter. So it's still a big issue for many parents right now as we're having a huge wave of respiratory viruses, febrile respiratory illnesses.
So what other options do parents have when it comes to children's painkillers? Are there any natural options, any online options?
Well, there are things you can use like lots of fluids, chicken soup, etc., lozenges. For as far as fever, you can take adult medications, and it's based on weight. So ibuprofen is 10 milligrams per kilogram. So a 20-kilo kid can have a 200 milligram adult ibuprofen, and you can crush it. Or a 10-kilo kid could have half a 200 milligrams. So there are ways of doing that. I would be careful with some of the medications that are not actually meant for those things. Naturopathic things or things online. I'd be very careful because you need to know what the active ingredients are.
All right, doctor. And we also mentioned that some parents are taking their kids to the ER for pain medication. What are your thoughts on that?
So right now, ERs are overwhelmed. They are in crisis. Kids are waiting for, I hear, anywhere from 12 to 24 hours. And so we should not be going to the emergency department and causing increased burden there to get prescriptions. So most of these infections, these viral infections, although they're very uncomfortable, they will go away, given a certain period of time, almost all less than 1 week. So, it's not great to see your kids suffer with a fever, but it's not life-threatening right now. And most of those kids, as long as they're feeding well, breathing okay, not lethargic, they will recover from this. So you shouldn't be going to the emergency department. Emergency departments are meant for emergencies where a child is having a real distress. And so there are alternatives, like if you can get a prescription from your family doctor, if you can take adult medications and divide it up, you can go talk to pharmacists if they're not overwhelmed to see if they can compound it. So there are other things that you can do.
All right, Dr. Banerjee, about a little over a minute left here, but let's talk about some preventative measures. How can parents protect their kids from contracting viruses in this virus-filled world?
So I think first thing is mask mandates or masks. RSV and influenza are droplets. They're spread through droplets, so masks really work. Get your children vaccinated against COVID and influenza. If you have a young child, make sure that there's no one sick coming to visit that child, and putting on masks. If it's an outsider, and making sure that if it's a young baby, to wash your hands. So those are some things you can do. If your child or anyone is sick, stay at home. You don't want to spread this, especially now. You don't want a sick child or someone else to have a sick child where they can't have access to acetaminophen or ibuprofen, and emergency departments are overwhelmed and there's no hospital bed. So right now, you don't want your kids to get sick.
Some important advice to consider. Dr. Banerjee, thank you again for joining us today on Forum Daily.
You're welcome.
The Forum Daily Week in Review will be right back after the break with a look at Canada's flu epidemic. According to the Public Health Agency of Canada, the rate of flu cases nearly doubled over the course of a single week between October 30th and November 5th. Our conversation with Dr. Abhishek Rout is coming up next, so stay with us. We'll be right back shortly. The Public Health Agency of Canada says the country has entered a flu epidemic. The agency says the rate nearly doubled in 1 week to 11.7% between October 30th and November 5th. Now, this is compared to 6.3% the week before. The surge in flu cases comes as Canada's healthcare system grapples with a triple threat of respiratory viruses: COVID-19, influenza, and respiratory syncytial virus. And some experts warn that the surge of respiratory illnesses in the country will continue to worsen. Well, joining us now to give us the latest on this is Dr. Abhishek Rout, Medical Director at Apple Tree Medical Group. Dr. Rout, welcome back.
Great to be here.
So, as we mentioned, Canada is now in a flu epidemic. What exactly does that mean, Dr. Rout?
Right. So the Public Health Agency of Canada declared an epidemic, which most years means they'll declare it after a threshold of about 5% positivity rate is surpassed. Obviously, this year we've seen almost 12%. So certainly we're looking at much higher levels than expected with even pre-pandemic years. What we're seeing as well is 13 confirmed influenza outbreaks in just the first week of the month, including 9 in long-term care homes and 1 in a school and daycare as well.
Now, considering that this is coming following the peak of the COVID-19 pandemic, how is the medical system handling all of this amid staffing shortages?
Well, I think it's fair to say that bowel movements continue to hit ventilators. I think what we're seeing at McMaster Children's Hospital is nearly a 140% capacity and a daily average of almost 200 patients per day in the emergency department. So what we're seeing in McMaster and many other places is just a very difficult time in healthcare where we're having a large capacity of patients coming in and it's difficult to handle.
Very concerning information there. Now, what do you think contributed to this rise in respiratory viruses just when we thought that we were out of our or are on our way out of the pandemic?
I think that's a very good question. We know these types of viruses, RSV and influenza, they tend to thrive in these dry, cold conditions. And what we do know is these colder conditions tend to make our bodies respond to disease and make us behave differently as well. We spend more time indoors, and indoors it can be a bit drier as well. And remember, these viruses enter through the mucus and our noses. So when it's more dry, we just don't have that barrier protecting us. So it makes it easier for viruses to infect our bodies.
All right, Dr. Rao. Well, we mentioned some experts are saying things are only going to be getting worse. How do you expect this triple virus threat to impact Canadians in the upcoming holiday season?
Right. So, not surprisingly, last year we saw a very high number of people experiencing the COVID-19 Omicron variant. I think this year we're going to see something very similar with different viruses. Also, keep in mind, we're going to see a lot more travel and gathering in the holidays as well. And the issue that I see here is that this is a triple threat. Last year, we could at least test for COVID-19, but we can't really test for RSV and influenza before going to a gathering. So I think the best thing to do here is just being sensible with those gatherings and trying to make them smaller when possible.
Important points to consider there. Now, what does this flu epidemic mean for the pandemic, considering that we've left the emergency phase of the pandemic?
I think when we look at it, every epidemic has its toll on our healthcare system and on us, whether it's ICU beds, healthcare provider shortages, or even caregiver fatigue. So even though we've left the emergency phase of one pandemic, having these other epidemics converge together is definitely not an ideal situation for anyone, and I think it leaves us very vulnerable.
Not ideal indeed. Now, something interesting to mention is that Moderna is coming up with a three-in-one vaccine for COVID, RSV, and the flu. What do we know so far about this, Dr. Rout?
Right. So at least a little bit of good news. So Moderna is promoting this COVID-19 flu and RSV vaccine, and we're hoping it'll take care of all of them. The only issue right now is we don't really have much data. So Moderna hasn't really released data to support the safety or efficacy. And without seeing these large phase 3 clinical trials, I don't think we're going to see much from the vaccine yet. And we probably won't see any approval from Health Canada anytime soon until we have that data.
All right, Doctor, a quick 45 seconds left here, but we're also seeing masking being recommended again in some places. What other steps would you recommend officials to take amid these viruses?
Yeah, I think what we're seeing here is, hospitals are going to continue to remain pretty overcrowded with patients there. So we've got to look at options to bring this down. I think masking indoors is a very sensible thing to do at this point here. I think it's also important to look at what the key demographics are that are especially at high risk and ensuring that they have their services so that they don't have to venture outside as well.
All right, Dr. Rout, always great having you on Forum Daily. Thanks again for your time today.
Hey, thanks so much for having me.
Bank of Canada Governor Tiff Macklin acknowledged that his female colleagues have faced harassment that he has never had to face. Our interview with Dr. Marina Adshade, professor at the University of British Columbia and an economics expert on the role of women in society, is up next. The governor of the Bank of Canada has told a central bank conference on diversity and equity that the economics discipline is having a Me Too reckoning. Tiff Macklin acknowledged that his female colleagues have faced harassment that he has never had to face. But Mr. Macklin told the event in Toronto that he's worked to create a culture of respect at the Bank of Canada. He adds that harassment of any kind can never be ignored, excused, or brushed away. Well, joining us now to continue this conversation is Dr. Marina Adshade. She is an economics and public policy professor at the University of British Columbia and an economics expert on the role of women in society. Dr. Adshade, welcome to Forum Daily.
Well, thank you for having me.
Now, we know that women have been speaking out against harassment and sexual abuse in the workforce for years, decades even. So, what is the current state of this issue in the economic sector in particular?
So economics is very male dominated. And in the last couple of years, when we've had the Me Too movement, a lot of the very male dominated industries have had to face the fact that it's just simply more difficult for women in those industries. Women face a lot of harassment, they face a lot of discrimination. And just like the governor of the Bank of Canada said, they face a lot of circumstances that the men just don't simply face. What's been kind of interesting is that whereas the Me Too movement in general started years ago, economics kind of managed to slide under the radar for a few years. But things have really accelerated in the last, I would say, 6 weeks in economics, where there's been it started as a trickle and then it turned into a wave of women coming forward and um, bringing forward their complaints about the way that they are treated, the way they're treated at conferences, the way they're treated when they present their research. And it's really forced the profession as a whole to have this conversation.
Now, Mr. Macklem is calling this a Me Too reckoning. So, what does that look like in the economics industry? What does he mean by Me Too reckoning?
I think that it's so interesting because, of course, the women in economics have been having this conversation. As you said, we've been having this conversation for decades. And economics, I think, has had a recognition that it has a gender problem. So that part isn't really new. The reckoning, I think, is that there are some individuals who are having to face some consequences for their own behavior. And that really is the reckoning. And some fairly high profile economists have been called out for their behavior and publicly. And of course, I think the profession is known as a whole that there's a number of people who have been problematic over the years, but now it's become very public. And so that's been very uncomfortable for the profession as a whole.
And it's interesting that Mr. Macklem made these remarks along with news of an economic slowdown. So, how does the issue of harassment in the economics discipline impact the overall economy?
Well, I mean, I'm unsurprised the Bank of Canada make the statement. Canada is actually, I think, very, very forward thinking when it comes to gender, and they've worked quite hard for gender equality within the bank. And the reason they've done that is not just because of a sense of fairness, but actually everybody benefits when we have better gender representation in the economics profession. Because of course, economists do research that guide policymakers, and those policies affect everyone in the economy, including women. And if we don't have women's voices in the economics profession, it adversely affects policies, but also it's not good for economic growth. It's not good for the general health of the economy to have only one group of people's voices represented.
And are there any certain sectors in the economic discipline that are facing harassment more than others? As you say, the Bank of Canada is quite the leader when it comes to equality. So, are there any certain sectors that are facing this issue more?
Yeah, I mean, so finance is particularly has a particularly bad reputation. Central banking actually, outside of the Bank of Canada, has quite a bad reputation, and macroeconomics, which is kind of both of those things come under that umbrella. Those are the professions that traditionally have been very male dominated. They're very masculine professions. It's if I could just tell you a quick story, is a friend of mine went to a macro conference, and she says the nice thing about macro conferences is that when she goes to the bathroom, there's so few women she can cry there all by herself, because the conferences are very, very difficult for women. So it's really, he's in the right position to be making these comments, because it really is those areas of economics that have been problematic, most problematic.
Clearly, a conversation that needs to happen. Now, a really quick 20 seconds left here, Doctor, but if you could leave us with one message for officials when it comes to addressing this, what would it be?
I would say that if we care about economic growth, if we care about standards of living, these gender issues, they're not just about fairness. They're really best for the overall health of the economy, and they need to be addressed so that Canada can be competitive with other nations that are addressing this pretty proactively.
And Dr. Adshade, thank you again for your time today on Forum Daily.
Well, thank you for having me.
Canada's Auditor General says the federal government doesn't have a good handle on what's going on in its Arctic waters. In a recent report tabled on Tuesday, Karen Hogan says the agencies responsible for safety and security in the North don't have a clear picture of traffic in the region. She says Transport Canada and the Canadian Coast Guard aren't ready for the challenges that will come as climate change opens those waters to increased shipping and economic development. She says the issues include poor surveillance and vessel tracking, ineffective information sharing, and aging equipment. Well, joining us now to discuss the situation in the Arctic is Dr. Rob Hubert, Arctic expert and associate professor at the University of Calgary. Dr. Hubert, welcome back to Forum Daily.
My pleasure, Nima.
So, what was your main takeaway from the Auditor General's report?
Well, it confirms a lot of the stuff that many of us who have been observing what the government is trying to do is actually doing. I mean, as most people know, it's increasingly difficult to get concrete information out of any government. Most of them, this one in particular, has learned how to hide it, and so I think the fact that we are seeing a very open, frank evaluation of just where we stand, and the picture, of course, that's painted is a very troubling one. When we start looking at some of the capabilities that we are talking about in terms of the maintenance of Arctic sovereignty and security, the Auditor General's report is quite damning on the lack of progress that we've seen.
Now, this report specifically highlights climate related challenges in the Arctic waters. So, can you tell us a little bit more about what exactly these climate related challenges are?
Well, a major one, in a nutshell, is ice is melting. What we are expecting to see, and this has come out in several reports recently, is that the permanent ice that's in the Arctic will be gone. And at that point, we can expect a very rapid increase in activities in the region. You immediately think of shipping, and that's what the auditor refers to. But there's also the possibility of seeing an increase in activities such as fishing, in terms of also seeing increase in mining capabilities. In general, what the Auditor General's report is very accurate on is it is identified that the Arctic will not remain this environment in which no one can go, and therefore we haven't really had to worry about it. And with all these impacts coming because of climate change, never mind on the geopolitical side, the question that was raised in the report is, are we ready? Do we have the facilities and the capabilities to proceed? And the answer that I read from the report is that the answer is no. And in fact, the Auditor General's report actually highlights certain areas where we'll probably be going backwards, such as in terms of satellite surveillance capabilities.
Now, that's really concerning to hear. So, if we're talking about solutions here, what are some ways to improve the surveillance of Arctic waters amid all of this?
Well, I think one of the things in reading between the lines on the report is if the government actually comes forward and fulfills what it says it's going to be doing. For example, we saw on a different note, we saw the defense minister saying that back in June that we're going to be increasing our surveillance capability in terms of satellite capabilities and over the horizon radar. And so we are constantly hearing this refrain of just wait, we'll look at what we're doing. But I think once again, the Auditor General's report, particularly the chapter that was looking at the successor to the RadarSat constellation, where it's laid out in pretty clear language that it's not at all clear that the government has a plan on replacing RadarSat, which is one of the most successful satellite systems that exist for Arctic observations, and particularly for ice cover and related, and that there isn't an active plan already in place or when the system reaches the end of its operational life, that we have something in place. And to do something such as satellite surveillance, replacing radar sat, it's not something you do over the course of a weekend, or well, I'm being facetious on the weekend, but it's something that takes a very long term and advanced planning. And the Auditor General's report suggests that that is not where we stand today.
Always an informative interview. I wish we could talk more on this, Dr. Hubert, but we are out of time. We'll have to bring you back, but thank you again for your time today.
I look forward to our next conversation.
Me too, sir. I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on Facebook, TikTok, Instagram, and Twitter for updates. You could also watch all of our news and commentary programming on the News Forum YouTube channel. Thanks for joining us today on the Forum Daily Week in Review, and we'll see you again next time. Have a great weekend, Canada. Take care.